Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight, I'm going to produce another classic masterpiece in my mental health series. This time, I'm going to talk about schizophrenia, the risk, the symptoms, and treatment. That's right, schizophrenia, the risks, the symptoms, and the treatments. Now, when we talk about schizophrenia, a number of us look at it as someone who's crazy. Well, crazy could be interpreted as an individual who's delusional. Their beliefs are false. They believe they can't do any wrong. But when we talk about schizophrenia, we talk about someone who has a chronic and severe mental disorder that affects how they think, feel, and behave. Now, people with schizophrenia may seem like they have lost touch with reality. That's right. Why? Because of the delusional beliefs that they carry. Although schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. Now, here are the signs and symptoms of schizophrenia. Symptoms of schizophrenia usually start between the ages of 16 and 30 in rare cases. Children have schizophrenia as well. The symptoms of schizophrenia fall into three categories: positive, negative, and cognitive. Now, the positive symptoms are psychotic behaviors not generally seen in healthy people. People with positive symptoms may lose touch with some aspects of reality. Some include hallucinations, delusions, thought disorders, usually or dysfunctional ways of thinking, mental disorders, agitated body movements. Then there are the negative symptoms. Negative symptoms are associated with disruptions to normal emotions or behaviors. Symptoms include the flat effect, or reduced expression of emotions via facial expressions or voice tone, reduced feelings of pleasure in everyday life, difficulty beginning and sustaining activities, reduced speaking. That's right. Another item to include with schizophrenia is you have a number of individuals who do not stay on topic. They tend to change subjects a lot. When the wind blows, it's easy for them to change directions. Now, when you get into the cognitive symptoms of schizophrenia, they're very subtle, but for others, they're very severe, and patients may notice changes in their memory or other aspects of thinking. Symptoms include poor executive functioning, the ability to understand information and use it to make decisions, trouble focusing or paying attention, problems with working memory, the ability to use information immediately after learning it. Now, of course, with every mental disorder, there are risk factors. There are several factors that contribute to the risk of developing schizophrenia. Genes and environment. Scientists have long known that schizophrenia sometimes runs in families. However, there are many people who have schizophrenia who don't have a family member with the disorder, and conversely, many people with one or more family members with the disorder do not have schizophrenia themselves. Now, scientists believe that many different genes may increase the risk of schizophrenia, but that no single gene causes the disorder by itself. It is not yet possible to use genetic information to predict who will develop schizophrenia. Scientists also think that interactions between genes and aspects of the individual's environment are necessary for schizophrenia to develop. Environmental factors may involve exposure to viruses, malnutrition before birth, problems during birth, psychosocial factors. You have different brain chemistry and structure. And of course, scientists think that an imbalance in the complex, irrelated chemical reactions of the brain involving the neurotransmitters or substances that brain cells use to communicate with each other, dopamine, glutamate, and possibly others play a role in schizophrenia. Now, some experts think problems during brain development before birth lead to faulty connections. Now, the brain also undergoes major changes. That's right. When it comes to your brain, with any mental disorder, particularly with schizophrenia, the brain undergoes major changes during puberty, and these changes could trigger psychotic symptoms in people who are vulnerable due to genetics or brain differences. Now, for every mental disorder, there are treatments. So because the causes of schizophrenia is still unknown, treatments focus on eliminating the symptoms of the disease. Now, some of the treatments include antipsychotics or antipsychotic medications are usually taken daily in a pill or liquid form. Some antipsychotics are injections that are given once or twice a month. Some people have side effects when they start taking the medications, but most side effects go away after a few days. Doctors and patients could work together to find the best medication or medication combination and the right dose. Now, what you need to do is check with the U.S. Food and Drug Administration. Again, the website is http://www.fda.gov for the latest information on warnings, patient medication guides, or newly approved medications. Now you have your psychosocial treatments. These treatments are helpful after patients and their doctor find a medication that works. Learning and using coping skills to address the everyday challenges of schizophrenia helps people to pursue their life goals, such as attending school or work. Individuals who participate in regular psychosocial treatments are less likely to have relapses or be hospitalized. Again, for more information on psychosocial treatments, see the psychotherapy's webpage on the NIMH website. Now, there are also CSCs, known as Coordinated Special Care. Now, the treatment model integrates medication, psychosocial therapies, case management, family involvement, and supported education and employment services, all aimed at reducing symptoms and improving the quality of life. The NIMH Recovery After Initial Schizophrenia episode, known as RAISE, research project seeks to fundamentally change the trajectory and prognosis of schizophrenia through coordinated specialized care treatment in the earliest stages of the disorder. RAISE is designed to reduce the likelihood of long-term disability that people with schizophrenia often experience and help them lead productive life. That's why RAISE is a program that's basically designed to help people who have long-term disability, and the long-term disability patients have schizophrenia. And with this program, it's a support system to help them lead productive lives. Now, how can you help someone with schizophrenia? Caring for and supporting a loved one with schizophrenia can be hard. It can be difficult to know how to respond to someone who makes strange or clearly false statements. It is important to understand that schizophrenia is a biological illness. Here are some things you can do for a loved one. Get them treatment and encourage them to stay in the treatment. Remember that their beliefs and hallucinations seem very real to them. Tell them that you acknowledge that everyone has a right to see things their own way. Be respectful, supportive, and kind without tolerating dangerous or inappropriate behavior. Check to see if there are any support groups in the area. You can also join a study, because clinical trials or research studies that look at new ways to prevent, detect, or treat diseases and conditions, including schizophrenia, during clinical trials. Treatment might be new drugs, or new combinations of drugs, new surgical procedures or devices, or new ways to use existing treatments. The goal of clinical trials is to determine if a new test or treatment works and is safe. Although individual participants may benefit from being part of a clinical trial, participants should be aware that the primary purpose of a clinical trial is to gain new scientific knowledge so that others may be helped in the future. Now, what I tell everybody about schizophrenia, it is a biological illness. Of course, we can link it to a mental disorder, but basically, the symptoms of schizophrenia are very real. This is why you have some individuals that you try to talk to, you lay the facts in front of them, and you do not feel as if you're telling the truth because they're seeing everything from their point of view. Basically, with schizophrenia, what you're getting is individuals who are very irrational. They have delusional beliefs. It's not that they're hard-headed. They really don't understand the topic sometimes, or they feel that their own beliefs are, I call it the king of the road. And some of them don't even know that they have these false beliefs. But it is our job with anybody who has schizophrenia or any other mental disorder to be very supportive. And the reason why I do a lot of these health videos, such as schizophrenia and other mental illnesses, because the bottom line of what's going on in society, we always look at everything from the top and ask, well, why is this happening? Well, a lot of events that are taking place, particularly here in 2017, when there has been a rash of murder suicides come from schizophrenia behavior, Stockholm syndrome. You also have narcissism. But this video just gives you an overview of schizophrenia because a lot of us don't talk about it. Now, again, if you're looking to find clinical trials, well, one of the best places to do is seek the National Institute of Health in Bethesda, Maryland. It's a good place to go. In fact, I went there and got my wisdom teeth pulled for free back in 1985. It's a place that the president, Reagan, went to, the National Institute of Health. Great hospital. Great place to actually do research. In fact, Maryland is one of the leading states in research because of Johns Hopkins as well. But when we talk about any type of mental disorder, we must continue to do research on mental orders because a lot of people don't understand what's happening. That's not mental orders. I apologize. It's mental disorders. Sometimes I slip up as well because my brain is thinking faster than I can speak. But going back to mental disorders, a number of us do have them, and we seem perfectly normal. Yes, we are, until an event happens. Now, last night, I did PTSD, which was post-traumatic stress disorder, and I'm going to do that topic in depth on a radio show this week, and I'm going to do schizophrenia next week because mental orders and mental illnesses are real, and they're in every community. This is why you have the level of dysfunction, because a number of us really don't want to talk about the mental issues. In fact, we'll sweep everything under the rug. And when we continue to do that, we make ourselves look very bad. Now, when it comes to research and statistics, known as RAISE, it's recovery after an initial schizophrenia episode. Well, the NIMH is a large-scale research initiative that began the two studies by examining different aspects of CSC, which is Coordinated Specialized Care, treatments for people who were experiencing their first psychosis. Now, NIMH Schizophrenia Spectrum Disorders Program. Now, this program administers funding to scientists doing research into the origins, onset, course, and outcome of schizophrenia, schizoaffective disorder, and such related conditions such as schizotypal and schizoid personality disorders. Schizophrenia Statistics, okay? Look on the NIMH webpage, and that'll provide information on the best statistics or the best stats currently available on the prevalence and treatment of schizophrenia in the United States. Now, there's also the schizophrenia clinical trials at NIMH, adults, and they also have one for children. Now, all these are found on the NIMH website. And again, check out the statistics, because when we get enough numbers about the cases of statistics, we can find out how to treat it through research, and there are programs that are doing research right now on this biological disease. See, one thing one must understand, all of these issues are tied together to emotion. You have your mental disorders, your psychological disorders, and your biological disorders. This is why we call people crazy. They really aren't crazy. They actually have this disorder, but some of them don't want to admit they have the disorder, and that's a big problem. When you know someone who has a disorder, you must educate them. Now, educating them is not denigrating them. It's just trying to lead them to help. Because myself, I'm not a counselor, but if I can recognize the symptoms, I'll be able to get the person help so they won't do damage to themselves or other people. But a lot of us, again, in our right minds, always think we don't have any type of disorder. Trust me. We have individuals walking around perfectly normal. It's like with the AIDS virus. A person could be normal one day and be sick the next day. This is how these diseases can overtake one's character and one's body. So, what we all must do, don't sweep the problem under the rug. And the reason why you're seeing a lot more cases than you ever did, it's not that they weren't around. We have 24-hour media coverage. We have more people doing research into these disorders. And this is why science is very, very important, because you can get information through laboratories, empirical data, and once you get all the information, you can develop medication. Now, the problem I do have with medication, I believe that the American society is over-medicated, and sometimes the medications that we take cause side effects. And once the medication runs out, got to go get more medication. So in other words, doctors keep prescribing us with medication, but it's really not making us better. It's just making us addicted to the medication, so we'll spend more money. And a lot of us don't want to understand that. Like cancer. There is a cure for cancer, but the government doesn't want to put the cure for cancer out. Why? Because certain industries are going to lose money, just like the combustible engine. You can run a car off water if there were an engine that was invented to run off of water. But again, the government doesn't want that. And one thing you must understand about mental illness, well, there are a lot of sick people out there. Mental illness is also a moneymaker for the doctors and the pharmaceuticals. It is bad, but it is true. And the people who are making money off of mental illnesses, they're the demons. They're the ones who don't care about what's going on. In fact, believe it or not, all these individuals making money off of mental disordered people, guess what they got? They got a mental disorder known as narcissism. And I'm going to get into videos on narcissism, but if you really want to get into some hardcore narcissism, you check out the Love Doctor, Andrew Benjamin. The Truth Hurts. He has hardcore videos on narcissism. He wrote books on narcissism. Check out the Truth Hurts channel, the Love Doctor, Andrew Benjamin. And once you understand what he talks about with narcissism, you'll be able to speak on narcissism, and you'll be able to pick out someone who is a narcissist. But for me, this video is about schizophrenia. It's very important that people understand this disease because it's in a lot of us, and some of us don't know we have it. So what I'm doing, I'm making people aware that this disease is real. So, at the end of the day, educate yourself about disorders. Because if you can do that, you're going to save not only your life, but other lives. Because mental health illnesses are real. They're nothing to play with. So bottom line, get involved and get educated. Because once you recognize the symptoms, you can get help for yourself as well as others. And that's my commentary for this edition of the 411 Talk Zone radio show for this evening, Thursday, May 4th, 2017. You can tune into the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. We're going to talk about PTSD this weekend on Blog Talk Radio. If you want to get in on the conversation, the guest calling number is 215-383-5785. If you want to get in on the queue, which means get in on the air, press number 1 on your phone, and I will put you on the air. And if you like my videos, please share and subscribe to the 411 Talk Zone radio show so I can continue to give you quality information for educational purposes from a professional and mature perspective. And when I talk about the 411 Talk Zone radio show for this information, I'm talking about the 411 Talk Zone radio show right here on YouTube. So tune into the 411 Talk Zone radio show with me, Leon Jones, while I continue to give you that education and knowledge on these mental health subjects. Because the information is real. Because on this channel, I do not engage in controversy, debates, or emotion, nor do I participate in drama or unnecessary bickering. Why? Because it's counterproductive. This channel is here to educate folks, to make them aware that the information that I'm putting out, particularly on these mental health issues, is real. And my job is to provide one with the knowledge so they can apply it to the real world so they don't have to struggle and they understand how the real world works. Now, this knowledge that I'm giving you is powerful, realistic, but positive. And that's what I do here at the 411 Talk Zone radio show, because knowledge is power. And if you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you want to find me on Facebook or Twitter, you can find the links under the video. Because these videos that I do are posted on my Facebook page and my Twitter page. So you have information that is coming all over my social media. And if you have a comment, please leave a comment in the comment section under the video. But make sure that your comments are pithy, no bloviating, pettifogging, or filibustering. If you wish to opine. Now that's it for this video. My name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed evening. Good night.